what drives a lot of the changes in medtech is really catching up with other industries. That's at least how I feel very often, having worked in both areas in technology companies, Google, Microsoft, IBM, Watson Health, and Siemens, and Varian, and now BD medical device companies. But I think one of the interesting aspects and most exciting aspects, I think, going forward is really how will, and everybody talks about it, but how will AI and ML, really artificial intelligence and machine learning, influence medtech going forward? I think we are not even in the beginning of that. We are in the very infancy stages of really just seeing that in other industries. So I'm really looking to what will it drive in our environment. And I think there's a lot to be said about automation that can be led by AI and chatbot technologies as you look at today, and really helping on the one side the healthcare field because of the staffing issues that we have and overwhelmed with everything that's going on. And on the other hand, really there's so many parameters these days to make decisions on in healthcare, and we get more and more parameters coming in because we get more data, and humans are not very good in digesting more than 5 or 6 parameters at a time, and machines are very good at that. So I think that will drive a lot of the future transformations and advancements in the medtech industry going forward. So I think that is really one of the aspects I'm watching closely. Then at the same time, you also have to look at what are the disadvantages there. I mean, if you saw the 60 Minutes interview this weekend with Google's CEO, then you could see that there's hallucinations going on. So in the healthcare field, obviously, you want to make sure that there's no kind of security or kind of risk on patient safety or people safety involved there too. So those are then problems we need to solve, is how to make sure that what AI and ML actually suggests is real versus hallucination that is coming up in that respect. So, but I think that will be something to watch out for and look at now, because that journey is starting now in other industries, and we as healthcare in the medtech industry, we should learn from that and start implementing that as well to move our field ahead and to really help patients as well as help the healthcare providers to be more efficient and solve some of their problems. So that's my take on that.
Yeah, I can pick a couple.
I agree. And piggyback on what you're saying, Gunther, I mean, ultimately, it's as simple as we cannot continue to exist in an old paradigm where disconnected devices are hidden somewhere within the hospital, because we can only work on data if the data is out, which basically means we have to somehow connect these devices and somehow get this data in the cloud. And all the current great tendencies, including artificial intelligence, machine learning models, ability to predict what's going to be happening with the patient, it's all based on the ability to work with this big data. So accessibility of that is paramount. So that's kind of a no-brainer. There's medical device manufacturers who will not be successful in that specific aspect of extracting that data out and starting to work with that would ultimately lose the competition on the market.
Yeah, I do like to add to this. What I was trying to say is that what is driving digital transformation, and we all, and I understand it's a MedTech gathering, of course, but my first experience is that a lot of it has nothing to do with technology at all, right? So I really believe that the technology will, well, except for the interoperability and data sharing part, but if it's more like on site, you can do many, many things. It is more like, and I used to also see this example of a nice AI solution that also from a Philips perspective was implemented in the hospital, but the local hardware and software just made it useless. because it just took so long to actually start it up and then run it. And that said nothing about the solution itself, actually, because it was doing fine. Actually, they were quite enthusiastic about the actual solution. But because it didn't fit the workflow, it was for specific cases. So you're not running it all the time. So you would only start it for specific cases. Yeah, but the time you would have started it up with the local hardware software combination you have, yeah, you would have done it yourself as a radiologist. So yeah, so I recognize all the things you're saying. I'm not saying they're not relevant, but I think there's quite a gap between, what is the reality on the floor and what we can do. And you see that the most successful innovations of this kind are highly specialist, right? Again, as I said, because they kind of box a little part with this highly like superhero doctor that does a very highly specialized thing. And there we can innovate and there we can use AI because it's so boxed. But for the big healthcare challenges, it's far more messy. So that is, I think, my first reaction. Like, how do you make all of these remarks all true, should all happen? But yeah, how are we incorporating them with the different perspectives?
Just a couple of thoughts from my side. I think when you think about I'll take the first two questions. The first one on the digital transformation, the MedTech device industry. So one is the external factors and the other one's the internal factors. So when we talk about external factors, all of you guys have already talked about our product is getting much more software driven. Our product is getting a lot more configurations and variants, right? It doesn't matter if we're like in Stryker, we're building a Neptune, if we're coming back and building a robot like a Mako robot. Our products are fundamentally changing from building, we used to call it a long time ago, the razor cartridge model, right? You have a particular thing, capital and base, you get one of these and you basically come back and get a repetition. That industry is changing and that's what we now need to produce. So there's that level of focus that's coming back and driving. And if you have connected devices, if it doesn't matter if you have the instruments out in the hospitals, you need to, your hospital wants to make sure that you're monitoring them. On the internal side, I think the digital transformation is driven by the efficiency. Many of the leaders coming in the medical device industry are coming from other industries, as Gunther said, in the last 10, 15 years. And I always say, compare your inventory turns in an automotive industry versus whatever, a medical device industry. And last 15 years, the plants were so busy just growing and making more and more. Now, all of a sudden, your demand is somewhat plateaued up. And you look at if my inventory turns are 2 or 3 and my buddy in automotive has a tier 1 of 14 and 15, what if I could even get it up to 4 or 5? And the dollars are staggering if we could go halfway in terms of all of that. The second part in terms of the barriers adoption for artificial intelligence, and you can interpret it many ways. I'll just give one interpretation. I'll pick, again, closer to manufacturing. I'll pick on something that is very basic, plant maintenance and predictive maintenance. I don't know any vendor you come back and talk through and they'll tell you saying, we can come back and figure out when your equipment's going to break down and when you need to do equipment calibration, and you can basically fix it. What you find is in order to drive those kinds of artificial intelligence use cases, you need a tremendous amount of base data. And you need to start with your basics. There's a perception that when you go to AI, you can go back, get off directly without step 1, step 2, step 3. But the first question in building an AI model is, where's my master list of all my assets? What's my preventive maintenance schedule? Do I have all of this stuff? And the last 2 years, do I have data of when did I come back and have a false positive? That's when AI comes through and builds it. For us in the medical device industry, because of the nature of our growth, we've not done all the basics. So we now feel that we do some a high-tech technology back to the house, and we find that all of a sudden, these foundations are not done. So it's that joint up thinking to both fix the foundation and build some of these technologies.
Yeah. I would want to add just one more aspect, which kind of became also pretty apparent recently. So, and that piggyback a little bit of what he was saying. On medical device manufacturer side, we tend to imagine that all we need to do is to solve the problem of connecting our medical devices to the cloud, building this nice mobile and web interfaces, introduce amazing algorithms, somehow get through ITS review in a hospital, get the contract signed, and boom, we have it. So that boom, unfortunately, doesn't happen most of the time because as great as this digital transformation products are, and as much as we as their creators love them, they are drastically different from the practices which clinicians adopt and used to adopt on their day-to-day for so many years. And they very often offer questionable benefit for their reasons of, just liability. Most of these products would say, this is what we think is happening to the patient, but please don't trust it. Go to the device actually connected to the patient and double check. Yeah. So when clinicians receive that type of products today, and this is what I'm describing as unfortunately attributes for 99% of what is getting offered and shipped, they have their own questions of why this is great product and what the adoption rate should be and how they would personally start treating patients better because they adopted that product. And so this is the area which I don't think today is very attended. I don't think today it's even recognized as a separate area which needs attention. But onboarding clinicians, motivating clinicians to change their practices and starting to use this digital transformation solutions, this is really a big area, and it requires a very serious attention, method, investment, and research, because I have seen more than one solution, otherwise pretty perfect, which was getting stuck on its way exactly at that part where clinicians should be gladly hugging you, picking it up, and start using it every day. And no, so I would flag that as also an additional consideration for digital transformation.
Maybe to
not about you, only how you make the product, it's how you onboard the hospitals.
And maybe to add to that, what makes it extra complex is that, yeah, there is a clinician using it, but then there is a whole MICT team behind it that has to be able to understand or to service oneself or to understand who is servicing it. And so there is a whole other world than in the hospital who also has to adopt it and support it. And if they don't keep it in the air, then the clinician cannot use it. And that's also a complete, an extra group of people. And to add to that is that what you find is that the hospital also goes through digital transformation oneself. And that's still something else than digital transformation of healthcare. And that's again something else than the digital transformation in the MedTech company. And I can tell you that the transformation in the hospital, we just, before I joined, they kind of finished their first digitization program in the outpatient clinics. And that's really about getting the facts out of the hospital. Right. So when I just joined, there was a celebration moment. The last fax went out. Now they're looking at the printers. There are like these hidden printers that doctors are using to print letters to send to whoever has to receive some, while they put also a lot of effort in making sure we can have safe or secure mailing exchange. But so both these printers and these faxes, they remain there because apparently that doesn't work, or people don't want to use that. And that is so next to in the Catharina hospital, you see fantastic, like highly AI, and so there's a lot of like things going on. But at the same time, the digital transformation, the first week I was like not happy because I'm on Microsoft 2013. Right. So imagine digital transformation in the hospital has a few more angles, and then then we can do all this data integration, but I want to access it with my kind of old machine, which is difficult.
I love hear you saying that. I mean, sometimes, especially here in the US, of course, we see a lot of this modernization of how you interact with your providers as a patient. That's actually pretty amazing. Sometimes I get the feeling in Europe, this is in general a little different, because my mother-in-law still has to walk to her doctor's office to pick up a piece of paper to then bring it over to a hospital. So stuff like that, where the possibilities are probably underutilized, but there's probably one or two good reasons for those: cybersecurity and patient data protection and so on, that you can always bring. And I think those are the factors that sometimes make it a little bit slower on that side. But I think still there's a huge drive and pulling forth. And as you pointed out, and I think as you experience today, is you can never move faster. You can never move as fast as the technology, because you need to bring a whole ecosystem with you in the technology. And again, always comes to mind from again, another industry in automotive, where once I looked at a fully automated engine factory. And if you know, engines are more complicated than the rest. And you look at the robots that built engines in a fully automated way, and you can see every one of these robots needs 2 dedicated engineers to keep it alive. And I really looked at this and said, is that really economical? Because if you would do it a little bit more manual, you would need, your machines wouldn't be so complicated. And I think that trade-off, in every industry, I think mistakes are being made. People go a little bit overboard in trying to automate and digitalize and do things, and then they find out that the effort to keep that system running and supported sometimes really annihilates the benefits. Then you could say, oh, a simple person sitting on a phone might have been much more efficient than this super mega digital system that we built. And I think there's some learning lessons probably in the hopper, how far you can go.